Cystic fibrosis is one of the most common life-limiting genetic disorder affecting Australian lives today, for which there is no cure. It affects the respiratory system and the digestive system, primarily the lungs and pancreas. The cells that produce secretions such as mucus, sweat, or digestive juices, causing them to become thick and sticky, which then plugs tubes, ducts, and cause serious harms. It is the most common for people of European descent. Cystic fibrosis is a congenital disease, meaning it is a medical condition that is inherited from one's parents' genes and is not contagious. It is caused by a mutation in the autosomal recessive CFTR gene. The term autosomal refers to chromosomes that are not sex-related, and recessive means that both parents need to either have the condition or be carriers for it for the condition to be passed on to their children. Nowadays, 1 out of 25 people in Australia are carriers of the disease, and around 1 out of 2,500 people have both genes defective and therefore have the condition. The CFTR gene, which stands for the Cystic Fibrosis Transmembrane Conductance Regulator, codes for the CFTR protein. The CFTR protein is a channel protein that pumps chloride ions into secretion, and the chloride ions help draw water into the secretion, which thins the secretion out. The most common mutation of CFTR is the delta 508 mutation. This prevents the protein from pumping chloride ions across the plasma membrane into the secretion, which consequently leads to the secretion such as mucus and digestive juices to become overly thick. In the case of the lungs, the thick mucus produced makes it difficult for the trapped pathogen to be expelled from the body. They will be trapped inside of the body and cause serious infections. In the case of the pancreas, the pancreatic enzymes secreted will become too thick to come out into the small intestine and digest food. Proteins and fats are therefore not absorbed. The symptoms of the disease include a persistent cough or sometimes reduced thick mucus, difficulty breathing, frequent lung infections, salty sweat, tiredness or reduced ability to exercise, poor growth or weight gain, diarrhea or constipation, poor appetite, diabetes, and infertility in males. Since 1986, all newborns have been subject to a heel prick test. This test is used to screen for a number of conditions, one of which is an indicator for cystic fibrosis. Diagnosis may also result after baby is born with obvious CF symptoms, such as a bowel blockage or failure to thrive. The heel prick test does not detect everyone, and the definitive test for CF continues to be the sweat test, as high level of salt in perspiration is extremely common among those who have CF. Treatments can ease the symptoms and reduce complications. However, there is currently no known cure for the actual disease. From birth, a person with CF would undergo constant medical treatment and physiotherapy. They may need to consume up to 60 capsules per day to help digest food, and may need to do up to 4 hours of airway clearance each day. Treatment for the condition generally includes intensive daily physiotherapy to clear the lungs, enzyme replacement capsules with food to aid digestion, antibiotic therapy to treat lung infections, aerosol mist inhalation to help open the airways, salt and vitamin supplements, a nutritious diet that's also high in calories, high salt, and high fat. Thanks for watching.